The Street Corner Soapbox. The Street Corner Soapbox with Falso and Willin. Podcast takeover. We're making a killing. Music to nightlife. Debauchery and street news. Serving it hot. We are some street news, movies and mayhem. The craziest guests, words from chaos. Get it off our chest, Rhode Island, worldwide. Dark corners in all places. Speak how we live, radio show, smoking aces. Ladies and gents, for the people we're talking. Take the show on the road, right where you're walking. Yeah.
That's right, ladies and gentlemen. Street Corner Soapbox Podcast coming to you live. That's right, boys and girls. Street Corner Soapbox. Now, we all know during this crazy time with the pandemic, businesses are struggling. So we're here to support local businesses, and we need your help to do so also.
That's right. So subscribe to our Patreon, become a member to help support the show, and receive exclusive episodes and bonus content, as well as discounts on merch. That's patreon.com/streetcorner_soapbox2020.
Follow us on our website, streetcornersoapbox.com. That's right, boys and girls. Street Corner Soapbox. I'm back with my brother, Lord Willin.
Hey, how the hell are you?
Hey, what up, what up, what up?
Not much. What's going on?
Good guest tonight.
Good guest. Great guest.
Dr.Krystyna. You were going to do the Mosher.
Mosher.
Hi, guys.
Hi.
Did we say that right?
Yes, you
You were just telling us, and we probably already forgot.
All good.
Well, thank you for coming on.
Yeah. AKA TK. Let's not forget that. That's what she goes by usually, right?
Yeah, I tend to go by TK. It actually stands for Taegyeong, which is my Korean name because
Cool.
I'm half Korean, but TK is way easier to say.
Nice. And you speak Korean too, right?
I do mostly conversationally, but yeah.
Can you say something?
She just did.
I tend to be really shy, not gonna lie, about speaking Korean when I'm in the States, but
All right, well.
What's your other half?
I mean, white, Caucasian.
What kind of white? Irish?
Yeah, I guess like mostly Scottish and Irish.
Cool, man. Hell yeah. Braveheart.
Yeah.
Oh, yeah, right?
Right on.
Mel Gibson, dude.
Right on,
Mel
dude.
Gibson.
Right on. Right on.
Krystyna, you want to get a little bit into your background about your life? I know you grew up in Colorado, getting into Taekwondo and the martial arts.
Yeah, so I guess if to start at the beginning, I started in Taekwondo very, young, like age 3 and 4.
Oh, wow. Really young.
Yeah, but I was like a super duper shy kid. So as soon as we moved, because my dad was in the military, we moved the next town. I was just like too shy and scared of the new school. So I like didn't continue it for the longest time. And then I restarted Taekwondo in like 2015. Actually, sorry, it wasn't Taekwondo. I was in Korea to visit my family for the summer. I was doing a martial art called Tukgong Mosher, which is a modern kind of hybrid art that the special forces use. But, obviously I did like very basic stuff.
Yeah.
But it really kind of ignited my passion for martial arts. So I ended up getting my first degree black belt in that while I was in Korea. And I would train when I was back in the States. So it was just something I did over the summer. But once I got my black belt, I was like, well, maybe I should do something in the States to kind of keep up the martial arts, like fitness or whatever. And that's how I got into Taekwondo. And I started in Colorado. I did that for 2 years, and it was the WTF style, the World Taekwondo Federation. And when I came to Boston for undergrad, I joined J.H. Kim Taekwondo in Boston, and I stayed there until 2016, got my 3rd degree before I switched to Muay Thai. So that's more of like, I guess, my martial arts background.
Yeah. How'd you get into it at 3, 4, 5 years old?
So, I mean, since Taekwondo is a Korean martial art, so my mom kind of thought of it right away, but my sister and I were kind of rowdy. I'm a twin, so we were always like play fighting and stuff, and I was born in like 1990, and like Lion King had just come out, Power Rangers, so we were just like always play fighting, like Simba and Scar fighting, and then playing Power Rangers. My mom was like, "What the fuck's happening?" So she was like, you need to get this energy out somewhere else." So she put us in martial arts.
So you didn't start off in Taekwondo?
It was Taekwondo.
Oh, okay.
Yeah.
So you start off in Taekwondo, stopped, and then train the other art.
And you stopped for a while, too.
Yeah.
Now, when you stopped, were you still training in that other art here in the States?
No, I wasn't. I didn't do any physical activity for for the longest time.
Yeah.
And that had more to do with my mom being raised in Korea and then wanting me to be, successful in school. And in Korea, they don't care too much about sports, or they didn't. So she was just like, study, study, study. And so that's literally all I did.
So how long of a break did you have before you started training again?
10 years.
Oh, okay. I had a similar experience because I got into karate, whatever. It was Taekwondo, but, Americanized. And I trained that for I don't know how many years. And then I didn't do anything throughout my teenage years, which is one of my regrets.
Yes.
At all?
I wish, well, I played sports, but I didn't do any martial arts anymore.
You played sports in school?
Yeah. But I regret not continuing to train that whole time.
Yeah.
Because I would have been like fucking 10 times better now.
Yeah, definitely.
You know what I'm saying? Like.
Yeah, so like in middle school, I wanted to do. There's like a women's wrestling club, and I was like, I want to do
really?
wrestling, and my mom's like, that is a man's sport. And so like I'm just like, how cool of an MMA fighter would I be right now?
Oh yeah. I've never seen women's wrestling in high school.
It was middle school.
Oh, middle school.
Yeah.
Wow.
So I was like, this is my chance. And
I don't think I've ever seen that. Really? Women's?
I think they do, dude.
Really? I mean, nowadays it makes sense that they would, but I don't recall like ever.
even this, it would have been at least 10 years ago.
Well, I don't even, you know what? The schools I went to didn't even have wrestling teams, period.
Yeah, I mean, this was
Providence
Colorado,
doesn't?
so Midwest.
The schools I went to didn't.
Well, they have them out here, like West Warwick. Shit
Yeah,
like
it's
that.
weird. It's weird how, like, there's more of that in the suburbs.
Providence is a big city. You would have
but
a lot
I don't know,
of...
people don't wrestle, dude.
And that's and they should.
They should wrestle.
They should.
No, but listen, everyone should have that some kind of foundation, dude. Like, that, I think that would help people out a lot.
It's discipline. The training alone is discipline.
Yeah, wrestling's pretty crazy, too. Actually, Slippery Pete was talking about that's how he started when we had him on wrestling, and he went through that. And my cousin was a big time wrestler. It was definitely a lot of training. But anyway, all right. So let's stay on the topic of martial arts since we just brought it up. Can you just give people like a brief history of Taekwondo?
Yeah, I'm definitely not an expert, but it's a younger art because before that there was a couple different other martial arts floating around in Korea that still are, like Tangsudo, and even older and kind of more elite is the Hwarangdo, which Hwarang was like a group of elite warriors back in the day.
Yeah, right.
Yeah, so that's super cool. But and then Taekwondo kind of emerged, but then it kind of got stifled for a while there was the Japanese occupation. Like nobody was allowed to train because that's like how they kind of wanted to control the Koreans, and so it struggled for a while and like barely kind of made it. And that the WTF is the more modern and more kind of national accepted organization because there's also ITF, International Taekwondo Federation, but WTF was adopted by the Korean government as like, this is the national sport or whatever. So since then it's still been very popular, but even in Korea there's not that many adult practitioners anymore.
Really?
Yeah. So
I wonder why.
It became...
Has MMA like taken over there?
MMA hasn't really taken over that much either, although like with Korean Zombie and the bigger UFC guys coming up, I think it'll change, but yeah.
Now they say like Taekwondo is I don't know, something like 90% hands and 90% legs and like 10% hands. Is that true?
Yeah. So I mean, at JH Kim, he kind of keeps us well-rounded, but when you're doing competition like Olympic-style sparring, not point sparring, but Olympic-style sparring, it is mainly kicking. So
why is that?
I'm honestly not sure. I think it's just the way it developed over time. Like WTF does a lot of like flashy kicks and like board breaks and stuff like that.
Right. That's the style I came from, was the whole, break boards, do fucking strip mall demos and like.
Yeah.
I was like, when I got a little bit older, like I was like, yo, I don't really want to do this.
Yeah, same.
But you were training like pretty serious Taekwondo, it sounds like, though.
Yeah, I tend to get super involved and take shit maybe a little too seriously.
Yeah, I hear that.
So, as soon as I rejoined Taekwondo in like 2009 when I came to Boston, I was like, I'm going to compete. That's what I want to do. And I like fell in love with it. And I had just started PT school when I really injured my wrist. I tore this cartilage structure called TFCC, and it made it basically so I could barely use my hand, even to turn a key or a doorknob, hold anything. And so it was during our unit in PT school where we were holding a lot of legs, and legs are heavy parts of your body.
Right.
So like I almost couldn't finish the semester because I couldn't like physically perform the tasks. So I just stopped. I stopped competing in Taekwondo in 2012, which is like right after I got my first degree, and I didn't compete again until I joined Muay Thai and then competed in 2019.
Now, did you go to Korea just to train, or did you have other reasons to go there?
Yeah, so I think, we kind of talked about it before.
Yeah.
But I go to Korea a lot as
Oh, that's
a
right,
kid.
yeah, you said that.
Yeah, growing up to see my family.
Right,
but
right.
in middle school, my mom got involved in, like, a homicide and shit, and, like, ended up going to prison in Korea. So then I started going to Korea over the summer to visit her.
Okay.
And the martial arts was kind of just, it started out as something just kind of filler, just to fill my time. And like, I've always kind of wanted to I always wanted to be cool. Like I grew up a nerd. I wanted to be like that warrior chick that does badass shit and
No
stuff.
doubt.
And I was like, maybe I can get into it a little bit. And so anyway, I would go to Korea mostly, I guess, to see my mom and just visit with her.
Now, how does the training in Korea compare to over here?
So, like I said, now there's not that many adults. So I was the big kid in the class. Yeah, I was a white belt. I was.
You were that person.
I was that person. Like everyone else is like 9 years old or younger, and then I'm like the giant, like 15-year-old white belt, just trying to like fit in and like catch up. But so I guess I'm not afraid to like jump in and like be the odd person out which is what kind of I was for a while, kind of jumping around different martial arts and stuff.
What do the adults do there after when they get to a certain age and they still want to train?
I'm not really sure what the women do, because now it's becoming more acceptable for like women to like exercise and stuff, but it was still like not that much back in the day. But the men, because of conscription, they have to serve in the military, so it almost like translates over like, oh, they still do martial arts and combat training in the military, and then some of them still do it as like a career afterwards, but most of them don't go back to it. It's just kind of like a skill that they sort of all have a little bit of.
Okay. Have you ever done the Hapkido? That's another Korean art, right?
Yeah, so I have not done Hapkido, but there are Hapkido things in Tukgong, which is the first martial art that I did. So like the wrist lock stuff, and like I was taught a few judo things and like things like that.
Oh, cool, yeah. So then, you pretty much said you want to, kind of move on from Taekwondo and start training Muay Thai. And this is where actually we met, because we both train at Sitayatong in Boston. Shout out to Crew Mark. What did you think of the transition going from Taekwondo style to Muay Thai?
That was really hard for me, and I because even though I did competition Taekwondo, I still had to learn all the forms and shit, and like things have to look pretty and stuff.
There's a lot of kata in Taekwondo.
Yeah, it's called pumse.
Even Olympic style.
Yeah.
Okay.
And so you still are taught to make things look all pretty and shit like that.
Yeah.
But
flowery.
Flowery. But just the weapons are slightly different. Like even the kicking. In Taekwondo, you kick with the instep of your foot, where in Muay Thai you're kicking with the lower shin. And then you just have so many more weapons available. So I had a bad habit, and I still do, of keeping my hands way the fuck down.
Yeah, well, I noticed that about Taekwondo fighters is they keep their hands low and they bounce. It's a way different stance than Muay Thai.
Why do you think that is?
I don't know. That's just I don't know. Correct me if I'm wrong, but I think part of it could be because they throw so many kicks that they want to
have to keep it kind of low.
Yeah.
Because exactly. Like in the competition, you can't strike to the face. You can only punch to the torso. So you usually use torso punches to mostly create space or interrupt movement
for
forward.
a kick,
kind of like a teep. But
okay.
Because you're just doing body kicks. Your hands are primarily down to protect from the point.
Yeah.
Because you're not always kicking with a lot of power, and it's the instep of your foot.
So when you went over to train Muay Thai, were they like, okay, you got to stop with the the Taekwondo? Because I've noticed it's happened with other people that have come through. Like you could tell they have karate backgrounds. Not that all karate is the same. Or actually, would you even call Taekwondo karate? That's another question. Because karate purists, we had one on recently. He probably wouldn't. I don't think he would.
Well, it's different.
Well, but it was lumped in with karate here, though.
It is lumped in with karate,
you know what I mean?
here.
Well, I think because it's culturally changed, maybe.
That's different. I mean, Taekwondo,
Korean culture.
You can't just lump all Asian cultures into
I'm saying
one.
Korean American versus just straight Korean.
I think what it was is karate's Japanese in its origin, and Korean is Taekwondo is Korean in its origin.
Yeah.
Right.
So I mean, I don't think the martial arts community mistakes them, but I think the people who don't know the traditional martial arts often mistake them because, I mean, probably because even when I was growing up, people would be like, "Are you Chinese or Japanese?" Like, people don't know Korea.
Yeah.
Like, now they do, but they didn't back in the day. So they're like, Chinese or Japanese? Oh, Korean, whatever, Japanese. So it's just kind of, I think it was just honestly like a low key racist like type of a thing. But they are. I mean, you can't tell a Korean person that Taekwondo is karate.
Yeah. Oh, yeah. They get mad. I mean, unfortunately, nowadays too, the most we hear about Korea is North Korea. You know what I mean? So it's like people might not even realize the other aspects of the culture.
It's true.
You know. So anyway, you've had 2 amateur fights now, Muay Thai fights. I think I was at the last one. Was that the last one you did?
I think so. October last year.
Yeah. So you've had two fights, 2-0 amateur. Mm-hmm. How did you find that?
Well, so I've been wanting to compete for a while. I had done Muay Thai for almost like a year and a half before I competed.
Yep.
But honestly, I loved it right away. And I don't know what's different about it, or different about the training that I did, but I'm such a different Muay Thai fighter than I am a Taekwondo fighter. And even people who came to my first fight, some of them were my Taekwondo friends, they were like, you were completely different, like not timid, not whatever.
You can't be. You can't be. In Muay Thai, you cannot be timid. That's for damn sure.
There's too many weapons coming at you.
Yeah.
So honestly, I fell in love with it, and it's to the point where I'm dedicating a ton of my time and effort in trying to build a fight career, basically.
Cool. Yeah. Well, you already got started. So
yeah.
Now, obviously in Taekwondo, we already said there's not a lot of hands. In Muay Thai, there is. How did you find that?
Well, so it's almost kind of funny because now I don't kick as much as I should. Like I work a lot with Chip.
Yeah.
I
Shout out to Chip. Chip the surgeon.
And he's always like, kick more, and I'm like, damn, how did I get away from kicking so much? But it's because like my hands were so bad that I was taking I was doing like boxing classes and stuff to like make up for it.
Yeah, that makes sense.
Even like head movement and stuff is, I mean, you think it would be good maybe from Taekwondo, but it really is not. And so honestly, I did. And I'm still trying to do a ton of boxing to kind of supplement that.
Yeah, that makes sense because you know that's the best training you're gonna get for your hands.
Yeah.
It's just straight boxing because that's all they do. You know.
Yeah, we talked about that a bunch.
Even though if you're fighting Muay Thai, you might think, well, but you're still training Muay Thai, but then on the side you're training boxing to make your hands even sharper.
Yeah, and like I already have strong kicks. I just need to remember to like come
to not like to not snap them as much.
Yeah, don't snap them. Yeah, I need to make them heavy. Another thing Chip always says to me, heavy.
But coincidentally, if you notice, like there's some pro Muay Thai fighters that throw snap kicks too.
Yeah.
You
Like
think you're focused more on hands because you're just training that way to make up for it, like a second nature kind of thing?
Yeah. So now it's to the point where I can like, you know, keep up with the boxing with my opponents and stuff. So like I just have to remember to keep kicking.
Makes sense. Kick with the shin, not the foot.
Yeah, exactly. I still have that bad habit too, like kicking elbows and shit.
Yeah, it happens. It sucks.
Yeah.
So in 2015, you got your doctorate in physical therapy. Mm-hmm. What pursued you to like?
What inspired you to
pursue?
Basically, what inspired you to get into physical therapy? What was your motivation?
It's a good question. So, you know, I kind of struggled with what I even wanted to do with my life because my mom was always pushing, like, be a doctor. I want to be, like, so many things. An artist, a policewoman.
Policewoman, huh?
Yeah, I know.
Oh, wow.
Like an astronaut. I wanted to be a
right.
fucking astronaut. And honestly, doctor was just kind of there because she had put it in my head for so long. And so anyway, I ended up going to BU for undergrad in the pre-med program. And I was just like, I don't want to do this. I don't want to be in school for this long. But I had already, like, taken so many science courses. I'm like, what am I going to do with myself? So I switched out of pre-med just to get out of that mindset into human physiology. Super easy because it's, like, very overlapping. But I happened to walk by a pamphlet where it was advertising the DPT, the Doctor of Physical Therapy program at Sargent College in Boston University. And I was like, what's this? And I like I said, I hadn't done any sports growing up, so I had never been injured, and I'd never done physical therapy, literally never heard of it. And I was like, it's a doctorate, it's grad school. It says, if I can get my GPA up, I can, go straight into grad school without taking GREs and stuff. And I was like, I don't like standardized tests. I'm gonna fucking try and get in this program, not even knowing what it was. So I'm like scrambling for the last couple years of undergrad, trying to get all my prereqs done. My GPA had struggled. Was the first time I wasn't a straight A student. Existential crisis right there.
Wow.
And
what did you get? What was your grades?
Yeah, so they threw me into a science class that was way above my head. So I had taken a high-level chemistry course in high school, so they're like, oh, take Chemistry 109. Chemistry 109 is for, chemistry majors. Day one is, quantum mechanics. I'm like, I don't even know what the fuck you're talking about.
Rob always excelled in quantum mechanics, didn't you?
Yes,
Yeah, but the way my mom had raised me, she's like, you can't quit. So I was like, I'd rather stay in here than drop the class. I should have just dropped the class. But, so I struggled. I got there was one exam I remember getting an F. I was
No way.
Yes. I was like,
wow.
What is happening to me? What is life? So
wow.
then I was like, what the fuck is happening here?
F is for fun.
Wow. Yeah, F for fun.
Yeah, F for fun. I wasn't even having fun, guys. I was not even partying in college. I was literally doing Taekwondo all the time. There's no reason.
So Taekwondo study.
Exactly. The boringest life ever, but I loved it. And then
so you just you stumbled upon physical therapy.
I stumbled upon it.
You weren't in high school I want to be a physical therapist when I get out of here.
So I didn't even know what it was until I had gotten accepted. I gotten accepted into the program, and then one of the requisites is you have to do 50 hours of observation. And I was like, okay. And thank God I did that, because I decided, I was like, shit, I really could get behind this. I really like it a lot. And the program.
So observation, you're just shadowing somebody.
You're just shadowing somebody. So I still didn't really know what I wanted to do throughout PT school, because it's, physical therapy is so broad. You could go outpatient and inpatient, but there's so many branches off of that as well.
Yeah.
And I thought it would be cool if I could be one of those physical therapists who travel with the Taekwondo Olympic team and stuff like that.
Yeah.
So I would always call that my fake dream. I was like, I want to, work with Taekwondo people. That's my
So
fake
you always had that in the back of your head?
Yeah, by the time I had finished PT school, even my practicum project, which is a thesis, was a 60-page lower extremity injury prevention for recreational adult Taekwondo practitioners. And
so that's what your thesis was?
That's what my thesis was. And
60 pages.
Yeah, it was way bigger than I thought it was going to be. I was like, what am I writing?
What's the typical thesis, the length? I never made it that far in college, so I don't know.
Honestly, so the thesis was because we called it a practicum project, because it literally it's one person was just researching even therapy dogs, and so she borrowed someone's dog, did a therapy dog program with someone else's dog, and then wrote a paper about it and this and that. So you could do anything you wanted. So I was like, I'm gonna do it for martial arts.
Yeah, that makes sense.
With the goal of distributing it to local Taekwondo places. But what I found out was people were just so resistant to the idea that people could get injured. They're even my master was like, no, that nobody gets injured here. We figured it
really
out. Yeah. So I was just so frustrated. But I was like, well, I wrote the practicum, it's done, this is PT school. I was like, I just not going to think about that barrier right now.
Right.
I took a job right out of PT school because I thought I had to, and then I was just so bored and uninspired. And I had met my fiance about 6 months after I started working, and I would tell him this is my fake dream. I want to work with Taekwondo people. He'd be like, why is it a fake dream? I'd be like, I don't know. He's like, you could totally do it. What's stopping you? I'm not sure.
Right.
So I was like, okay, that's in my head.
Yeah, it was you stopping you.
Yeah, just me. So that kind of got in my head, and then I went to my first PT conference in the summer of 2016, and it was in Boston. It was the next APTA conference, and I just listened to it wasn't about combat athletes. It was actually about tactical athletes, the police force, military, stuff like that. And also, they did talk about football athletes as well. And I was just so inspired. I was like, I want to do something that I'm inspired by. I do want to enjoy my job. I don't want it to be just a 9 to 5.
Did you ever think about getting into the military or joining the military?
You know, I did, and I have kept coming back to it because, you know, my dad's was in the Army, and honestly, like, now that I'm invested in my relationship and with my work right now and my clients, like, I don't want to leave that behind, so I haven't. But yeah.
Now, you received a doctorate in physical therapy. But you said that's different. You were telling me earlier that's different from like what people think of getting a doctorate.
Yeah, so it's just that so I guess to take a step back, physical therapy used to be not a doctorate, right? It used to be a master's, and then before that a bachelor's. And it, you know, physical therapy has grown over time, and we've found that we have the ability to diagnose most musculoskeletal impairments and disorders and stuff in the clinic with good confidence, without having to get any imaging, which is more expensive. And so to have that diagnostic ability, and sometimes people are coming to us before they're even going to their primary care, so that's you know, that access to us directly. We really push, I think that's one reason why we're really pushing the profession to become doctorate level, because we have that diagnostic ability, which we didn't before. So, you know, before you'd go to your PCP and you'd be like, oh, doc, my like knee hurts. And then they'd write like a prescription, and they would write like diagnosis like knee pain.
Yeah.
It's like, great, doc. I didn't know that before I came here. So like, it's not specific at all. So we get a knee pain, evaluate and treat, you know, something super fucking generic. And then it's our job to like decide what's going on and go from there. So,
but there's physical therapists that don't have doctorates, right?
yeah. So, I mean, because now they're having to do like transition programs and stuff like that for people who have an MS and want to be a doctor. There's a lot of like resistance, because it's like, why, you know, I've been practicing for this long. Why do I need to do that again? And I can't really comment on that because I'm just someone who got in through the doctorate program. But
right. Yeah, you just took it to the highest level.
Yeah, the hope is that even if you have an MS or whatever, like the hope is that you're still doing continuing education throughout the year and over the years, and so you're continuing to grow, and it shouldn't matter too much if you had an MS back in the day, because you still have the same basic abilities now, you know? I mean, that's the hope.
Yeah, well, I guess that's what's happening, right?
Yeah.
I wanted to ask you too, so you grew up in Colorado and then you went to school in Boston. How'd you find that transition?
So, I mean, the biggest transition for me was just living in a city that was so noisy.
Yeah.
So I'm used to living, you know, in Aurora, Colorado, where there's not much light pollution, and we lived in kind of the suburbs, so there's not that much noise either. Like, we got coyotes howling every night.
Oh, that's dope.
Yeah, super dope, and like shit like that. But then I come into the city, it's like nonstop noise, so like I didn't really sleep that well and stuff like that. But honestly, I have acclimated so well to the city that I'm like, I can't even live out in the suburbs anymore.
No,
like,
now you need the noise.
I need the noise. I need the convenience of everything, like right nearby.
Oh yeah, you just walk there.
Walk everywhere.
I would say that's a pretty big transition from the suburbs of Colorado to Boston.
Yeah, one thing that's kind of weird was I loved hiking in Colorado, obviously, but when I came to Boston, I just...
When did you come in Boston? 2008, 2009? 2009.
I like didn't hike. I like was like, these are like not even mountains.
Oh yeah, I mean the fucking Rocky. You got the Rocky Mountains in Colorado, dude. It's a little bit different out here.
Yeah.
What do we got? The Berkshires.
Through Colorado, I drove through. I talked about this before. I drove through Colorado, and it was like one side of it was 2-lane road. One side was falling rocks for like 2,000 feet, and then the other one was like on the other side. It was like a 2,000-foot drop off.
Oh yeah,
like,
all the time.
You know what I'm talking about? Yeah, I was like, what the fucking like, what are you doing?
You're like driving. There's goats on the side of the mountain.
Yeah, the goats. Yeah, man.
Oh man, I've been to Colorado once.
Goats.
I was there for like 3 days, and
Damn.
I was in Denver and Colorado Springs. I didn't see any goats.
I liked it, but
Denver's a nice city.
We went through a goddamn mountain the road was like through the mountain, and it was like you're past the point of like help. Like if you get into an accident, no one's coming. They're like signs. You know what I'm talking about? Or that like I'm like
Good
crazy.
luck.
The air.
No helicopters ain't coming, dude. Like you're done. Like
the air's like way. You get drunk way quicker there because like the air's so fucking thin or whatever.
They moved to Colorado.
Yeah. We drinking half as much as you do now.
Save some money.
So you started working at a small outpatient orthopedic private practice, tongue twister, where you were treating various conditions. You did that for about 2 years, and then you started your own practice, TKO Physical Therapy, in 2017.
Yeah, so it began, so I went to that conference in 2016, and that sort of like sparked it. So I had just joined SIT in like mid-June.
Okay.
And it took a while for me to join SIT because I had a stress fracture in my hip, and so I couldn't do shit. And then I was rehabbing myself out of that, and then finally rejoined. But I wasn't sure how even to go about starting my business or anything. So my initial thought was I'm gonna try maybe to go back and get do a residency program for sports, and it's something I kind of still want to do. But I tried a couple years in a row to like apply to the Northeastern MGH program, didn't make the cut, and honestly now I'm like so deep into working that like, and also training, that I don't really want to take the time. But because I was thinking that initially I started at SIT, I asked Delagrati, I was like, hey, I'm a physical therapist, because I had just met him. Would it be cool if I started treating some of the fighters here pro bono? And so I started pro bono, which is just treating people for free basically. And it's almost like a active needs assessment too. Like, is there really like a market for this? And people, one, didn't know that much about physical therapy, so it took a little bit to educate them on that. And then of course they're just like, who the fuck is this bitch? Like telling me what to do? Like, no thanks. So it took a while to like honestly gain trust, but after they kind of see what I could do, it kind of caught on, and people wanted to start paying me. And
you're like, highly recommended now.
Yeah.
No, she is. Especially around the gym,
Appreciate it.
Yeah, no, of course.
It started super small, and then I started taking like small payments, like $20 here and there. And then, but at this time, I was still working at that small private practice. So, I was like talking to my fiance. He's, an investor and in the business world, finance world. And he's like, you got to do some math. You got to write a budget. And me being like, I didn't really want to write this budget, but I did anyway. And he'll tell you it was like the worst budget ever. He's like, did you even try? But I was like, you know what? I had like some basic math. I was like, X, Y, and Z, boom, done. I'm ready. I'm like, I quit my job, boom. And he was like, oh God, like, I hope this works out. But I didn't just like jump right into it, because I knew I was trying to be super niche. And, this patient population it's not like everyone's a fighter. So
right.
I was just trying to have enough availability, but be specific enough that I can start just working with this patient population of combat athletes, which is like, MMA, boxing, and Muay Thai and things like that. But I still had to pay the bills. So I had like 2 other part-time physical therapy jobs as well. I was working actually at, Mike Pellegrino's clinic in Arlington. It's called Peak Performance, and he runs it out of his jiu-jitsu gym. He's also a physical therapist. He's a black belt in jiu-jitsu, runs his jiu-jitsu gym, a really good gym, great physical therapist. But he really took great care of me, and I loved working over there. And then my other one was basically Medicare Part B, which is outpatient physical therapy, but in the home. So it was like outpatient, but I'm going to their home, kind of like what I'm doing for the fighters. And that, I was like running myself ragged.
So how many jobs do you have at once? 3?
3 jobs, and then I was still training like 6 days a week. And so I did that for like a year and a half, and then after a year and a half, I dropped the Medicare job, and I stayed with Mike Pellegrino for a while. But once the pandemic hit, I things kind of hit a wall, and then I decided like I only honestly like it was a very emotionally hard time for me. So I decided to just focus on TKO, my business, and here we are.
Now, when you started, when you said, when you asked crew, like, would you mind if I, start, doing physical therapy for injuries here? Were you just going up to people that were hurt and saying, hey?
Yeah, great idea. No, so I was hanging out during the Monday night Marathon Monday sparrings, and I would just hang out. I'd have my table already set up to kind of be like, a signal like, hey, there's something happening over here.
Okay.
And like, Delagrati would like introduce me and like encourage people to come see me. And then, one person saw me and then another person saw me. Then they're telling people that I did this for them. And then it's like
word of mouth.
Word of mouth.
Yeah,
It's been so powerful for me because, as you can see on my Instagram, I'm very poor marketer for myself. But have managed.
Well, we talked about that marketing. You're a creative person. We'll get into that in a second, but sometimes it's not easy to. I find that with music and everything. Even this podcast, dude. Like, I just tell him like, yo, just do all this other shit because I don't want to do it.
Yeah.
But he's like, yo, I don't want to do it either. So like, we like force ourselves to like.
I end up doing it.
Yeah. It's just, I don't know, man.
He'll get these fucking great ideas, and I'm like, hey, you got to learn how to do this. Like, what do you mean? I'm like, you thought of it, you do it. It's like, no. He's like, no, you do it. Just do it.
Yo, I mean,
Google it. He'll send me links, pictures, diagrams, everything. But no.
There's some people that are really into business and marketing and they enjoy doing that shit, and I'm just not one of them, yo.
Yeah.
I mean, you have to do it. You have to. Well, yeah, hashtagging's easy though, dude. That's not marketing.
Yeah.
You know what I'm saying? Like,
one thing that's come up is and I won't talk too much about it because it's the whole fucking topic in it of itself, but one thing that has really pushed me this year to like really get on this marketing thing and like really putting content out there is that there's a couple. I've had like in the past 3 years, I've had 3 fighters who've had a significant enough concussion, nothing super serious by any means, but a significant enough that there were some symptoms. And a lot of people don't know that you can get physical therapy for concussions.
I didn't know that.
I didn't either.
Most doctors don't even fucking tell.
I can talk about that a little bit.
Yeah. So honestly, it's you should, if you have a concussion or you think you have a concussion, just go see a physical therapist. We'll do a fucking like neurological exam, and if there's impairments, we'll help you with it. And if not, we won't. We'll just send you away and be like, well, sorry, you don't have a concussion.
Well,
What do you do for a concussion?
What would be the rehab for that?
So, so I guess basically one thing that I do want to say is back in the day, they'd always be like, oh, you got a concussion, stay awake for 24 hours, then rest in a dark room, this and that for like 7 days, and then like get back to life. But that's really, really outdated. Rest as a treatment is super outdated. But especially for concussion, and especially if you're an athlete, if you think about it on a day-to-day basis, even the amount of output you're doing for like the exercise for the training sessions is so much output that if you go from 100% to 0%, no stimulus, there's no way your brain is gonna like heal because you're not stimulating it to work in a way that it's supposed to. You're just letting it kind of like frizz out. Now they're pushing for graded aerobic exercise. So slowly using, it depends on the person because it's symptom dependent, but starting them off subsymptomatic, low, like no impact types of cardio, like a stationary bike or
so nothing for your joints and stuff like that.
But even for your brain. So like running, you're still getting that ground reaction force coming up all the way through the body into the brain. And if you've had a serious concussion, even that is going to fuck you up. So starting super low impact is like super nice. And then you can work your way up to like more and more impact types of cardio. But also there's a lot of other things that can be impacted, such as something called vestibular ocular reflex. Or
say that, Chris.
Say that 10 times fast.
Yeah, but it's like...
Say it twice in a row.
A lot of it has to do is like integrating sensory input from the eyes, and it comes in through the nerve and then goes through the brain, then thalamus, hypothalamus, everything's integrated, comes back out into some sort of like perception of the world, right? Yeah. So all that shit has to be happening correctly for you to be able to perceive and then interact and even perform a physical task. And if that's not working, it's not going to happen no matter how hard you're trying if you haven't allowed your brain to heal from that. So I guess in summary, a short summary is like graded aerobic exercise, and then finding a therapist who's comfortable evaluating and treating all the other possible impairments that could be happening, like that vestibulo-ocular shit, and like even like muscle tightness can contribute to like headaches, dizziness, things like that. But a lot of people are resistant to that. I'm not sure why. Concussion is very scary, and the exercises it does seem kind of weird, but I feel like that's
so aerobic exercise is basically in simple terms is what you use to treat concussion.
It's a tool in the treatment of concussion, and that's only on the physical therapy side. There's should be if it's a bad concussion, it should be a multidisciplinary approach where you're seeing a doctor. So
if someone has a concussion, they shouldn't just get on a treadmill and start walking and be like, I'm good.
Run a marathon.
Most people can like heal spontaneously, right? Like they just need a little time, and most people are resting, but they're not adhering to like true rest protocols, which is honestly a great thing in this case.
Yeah.
But it is important to have that low impact initially, because one of the negative prognostic indicators for concussion is if you get a second concussion, doesn't matter the intensity, second concussion within 10 days of the initial concussion can be very detrimental. So that's one reason why, like for fight sports, you get put on suspension from sparring and training. So you can heal up.
Makes sense.
I have a question for you. What's your thoughts on inversion tables? And I asked that because I've used one for years. I think they work. I have no rhyme or reason, but
people tend to love them or not love them, and there's not too much research out there, and physical therapists love looking at research, so we're just sad when there's nothing out there. But I'll tell you what my thoughts on it are. I don't love them, but I don't hate them. I don't love them because being upside down and having that like all that blood flow going to the brain can be too much. And depending on what you got going on, it could be very bad. But for the most part, I think it does do a great job for like low back pain, that traction, which can be really good to deload the spine. But it's best if you can couple that with exercises immediately after to work on the like lumbo-pelvic stabilization.
So just stretch yourself out kind of and then train to like work those muscles a little stronger.
The idea for traction is you're trying to decrease pain, and if there's any nerve symptoms, you're trying to decrease or change the nerve symptoms for the better, centralization, peripheralization kind of stuff, to then better tolerate movement. So all these passive modalities that physical therapists do, dry needling, like manual therapy and stuff, all that they're just tools to prepare you to be able to tolerate movement better. And then the exercises are kind of where the long-term benefits are at.
All right. Yeah, I was curious. And I don't stay upside down either a long time. Like maybe
only a couple seconds,
maybe
right?
Maybe like never over a minute.
Great.
But then it's completely inverted. Sometimes people go and they'll go longer, but it's not full invert.
I don't know. I've never done it. I've seen it.
I feel great after I use it.
Everyone says it. I don't know about everyone, but a lot of people say it works.
Some people
I really don't know.
Are uncomfortable. They don't like being upside down, and it does give you a head rush. Like
really?
I wouldn't.
Like
it does. I wouldn't do that for. Not even 5 minutes. It would probably it would be way too much. Like I'm up and out. I breathe. Focus on breathing, and then I stretch, and then
there's these areas in the brain called watershed regions, and it's where like the blood supply, like the blood vessels are small, and then they become capillaries in the brain. But if you have an increase in blood pressure, it'll push a lot more blood into the capillaries, and you can cause like low-level hemorrhages in your brain, which is kind of
terrible.
like what it's what happens. It's what can happen to like power lifters or people who lift really heavy if they're like straining a lot. That bounces.
That's why they start nosebleeds and stuff like that.
Yeah.
Interesting.
Makes sense.
That makes total sense. Did you what was that? It's kind of off topic, but there was a movie. Did you see the movie Concussion with Will Smith?
I did not.
It's about the Pittsburgh Steelers, but
I didn't see it.
But it's about the trauma that they had from pretty much hanging in NFL and stuff like that.
Yeah, well, there's the whole post-concussion syndrome, and then
it was all
they've attributed that to like suicides and fucking crazy bouts of depression and all that shit. So
depression is a symptom of a concussion.
Yeah.
Now would the aerobic exercise help that? Mm-hmm. Cool. I guess it's working then. I hope so anyway.
So Now you work primarily with all pro athletes, fighters, pro and amateur. What does this say over here? My bad, I'm fucking up.
You can't read?
No, not really. But I do want to talk about more dry needling. But you, what do you think that coming from a martial arts background helped you into therapy? Like dealing with your patients more or less.
I think it
clients?
does, honestly, because even if I were working with them like I do, if I didn't train, I really wouldn't understand what kind of fucking pain these motherfuckers go through, you know?
Yeah, right,
Like,
right. You relate to it on a
I can relate
personal
to
level.
it. And like every time I get sort of hurt, I'm like, this sucks, but now I know what this feels like. But therefore, what I really like through that kind of point of view is one thing that's really hard as a physical therapist is because, we're trying to give people exercises, is balancing the volume of exercises. Like, these people are exercising nonstop all day, all the time. Why are they going to do my exercises? And a my exercise is going to trigger another, like, tendonitis or something if they're, like, doing so much volume. So being able to understand the workload that they do, between like strength and conditioning and their sport specific training does give me a big insight for physical therapy.
Now, what is dry needling? Because I don't know. So for the people out there that have no idea like me.
Yeah, so dry needling, it's actually been around the idea has been around for a while.
I would think acupuncture.
Yeah, so I would not
that's what I thought too, but I
would
wasn't
not
sure.
call it acupuncture, and it's almost a sensitive subject across professions. But we use the same needle. So it's a monofilament needle. It's not a hypodermic needle, which has like a reservoir for like medicine.
Inside,
hence dry needling. But
so it's just pretty much a piece of metal. It doesn't have it doesn't have the hole.
Doesn't have the hole. Right. And the needle tip is kind of beveled, so it doesn't have like that cutting edge. I mean, it still goes through the skin.
Yeah.
It's the most like invasive procedure that a physical therapist can do.
All right.
But so, basically, it's a trigger point treatment. So it's a very super Western approach to the use of the needles. Like, there's no like energy flow. I'm not trying to manipulate something over here to affect something over there.
No chi flow.
No chi flow. It's literally like I feel the trigger point, which is like a muscle knot, a band. All those things mean the same thing. And then the needle goes right to it. The important thing is you need to know enough anatomy.
Yeah. I couldn't do this on Chris. So
Yeah.
Just stick some fucking needles in me and see what happens.
Yeah, because you don't want to hit like important blood vessels, and you don't want to hit nerves. You don't want to pierce things like ligaments, because ligaments don't have good blood flow, so they don't heal very well, and things like that. Or other organs, lungs, things like that. Super important. But that being said, so it's a trigger point treatment. So I found it. I'm probably most well known in the area for using the needles, to be honest.
Really?
Like, more famous than like my exercises and shit.
You're the top dog with the dry needle.
I'm the top dog with the fucking
So
dry needle.
anybody out there that's interested in dry needling, contact TK immediately.
Yeah.
Like yesterday.
It is. I mean, one reason why I love it as well is because it has an immediate effect. But if you have a muscle knot, first of all,
I got needles downstairs. You can stick me in my back.
Yeah, bring some of those needles up there. My fucking traps in the neck was bothering me. See if it works.
So what even is a muscle knot though? Like,
I don't know.
Yeah, right. So people are like, is it bone?
I would say it's like a soreness.
Yeah, so it's basically.
Is it a tightness? I don't know.
It is a tightness. So it's basically a part of a muscle that is in spasm, that's contracted, and cannot relax. And so so that's why I feel so like a rock, or you can roll it sometimes.
Yeah.
That little portion just wants to like roll. Muscle should be nice and soft. So if there's like a muscle knot, then it really shouldn't be there. But that being said, there's also muscle knots that don't have any pain. Like, if you touch it, it doesn't really hurt. And so if it's not painful, why treat it? I mean, if it's impeding motion, then you can treat it. But like, if it's not problematic, then maybe it's a protective type of spasm, which are those types of spasms as well. So being able to understand that.
But the protective spasm is more like once you have trauma happen to you, like immediate. They're not like long lasting, are they?
They can be long lasting. Yeah. And muscles tend to get tight. They spasm usually for kind of two-ish main reasons. One, pain. So they are trying to protect the area. And the other one is that the muscle is actually weak, that it's overworking beyond its capacity. And so, but then when it spasms, it can then cause pain to itself and then perpetuate the cycle.
I think I get them in my neck or like traps all the time, but I just fucking I just massage myself and go away.
So basically, massage.
Okay, give yourself happy.
Yo, listen, man. I do that regularly as well, but not at the same time. But I might try that. I don't know.
Yeah, we got to get a name for it.
No, but massage is great, but sometimes the muscle knot is very deep. And so there's no amount of force that I can produce with my hands.
Yeah.
No matter how strong they are. Not even with my elbows, because I do use them. But there's no amount of force that I can produce with my, body that can penetrate deep enough to access some of the deeper muscles. So that's where the needles come in soup. Like, they're so useful, especially like example, low back or neck. Sometimes you need to release the multifidi, which is a deep, deep, deep stabilizer. And you got to get really deep, and there's no way my hands can do that. Nobody's fucking hands can do that. And so sometimes it's like the needle is just a great tool to like quickly relieve a muscle tightness that may be causing a bunch of other dysfunctions, and then that way we can start exercising and correcting for that dysfunction, and hopefully that trigger point stays away.
Now, would you say dry needling is the westernized version of acupuncture? I
would not say that.
No,
I wouldn't and could not say that.
Would anyone say that, or is that just...
I mean, if they said that, I would honestly question.
I would argue.
I'd be like, I wouldn't believe.
I have a question. What's your thoughts on the...
No, fair enough. I don't...
The TENS machine or STEM machine.
Yeah, so...
Because I have those. I bought the gun, the massager, which actually works really good if you have someone to use it. But I did buy those, and I feel like they work. I don't know the science behind it.
Yeah,
really.
So, I mean, the TENS unit... So, eStim has you can, depending on the setting...
Well, sometimes, I can drop... I would do it with my brothers. I'd set them up, and I'd jack it up all the way and, like, drop them.
Yeah, so, I mean, there's different types of uses of eStim, but specifically for TENS, it's used for, like, pain relief. So, using a hot... It's basically... So, there's this thing called gate control theory. I'll just super quickly explain it. Gate control theory...
Away.
No, go get into it.
Just basically explains that there's... So, take a step back. There's nerve fibers that do light touch sensation, and then there's nerve fibers that do pain sensation. They're different. So pain fibers are not insulated. So think of a wire with no plastic around it. It's just a loose wire. Yeah. Sparks are flying everywhere. The signal travels really slow, actually. So, but in a sensory fiber, it has a ton of insulation, and so the signal travels super fast. It's very efficient. And so if you're having a pain in an area, and you put a sensory stimulus over that area, like you stub your toe, you grab your toe, and you're like, fuck, that hurt.
Yeah.
That sensory input over the toe travels faster to your brain than the pain nerve. Your brain senses that, sends an inhibitory signal down, and stops the pain, some of the pain nerve conduction from reaching the brain. So you can decrease pain by applying a sensory input to the area, which is how kind of like BioFreeze and like Tiger Balm and things like that work. It's not that they're bad. It's just
they
that
smell funny.
I like how BioFreeze smells. Actually, I use it on my BioFreeze on my neck all the time, dude.
And it's not that it's bad to use them. I'm always a fan of anything that decreases pain. Yeah. But just understanding that it's decreasing pain and not changing anything else physiologically is important.
Yeah, but it's better than taking like a.
All right, so let's say like I have a lot of neck pain, right? So what should I be doing?
Cut your head off.
Well, you know what? I was doing acupuncture before COVID, and it did help. I will say that.
So, in addition to that, doing scapular strengthening exercises, in addition to neck strengthening exercises, will actually be super helpful.
What is scapular?
Scapular, so scapular meaning scapula, meaning shoulder blade. So a lot of your neck muscles, including your traps, begin on the shoulder blade. And so a lot of times the upper traps, that portion on your neck, gets super tight. People tend to hold stress there, but also if you're lifting, you tend to strain and kind of shrug up. But the trapezius is bigger than that upper portion. It has a middle portion and a lower portion, and oftentimes those middle lower portions tend to be weaker, but the rhomboids tend to be weaker. And kind of just as you go down the spine like that, those muscles, we tend not to use them as much or strengthen them as much in regular exercises, so they tend to get weak. Then you get this kind of imbalance of like weak lower muscles, hyperactive, muscles that are superior to those. And anterior, and then that kind of muscle imbalance is what allows that tightness to perpetuate. So correcting that imbalance will really help kind of keep things loose. And I mean, I feel like I work out a lot and I put my body through a lot of stress, and I have managed to treat myself and be fine. If that can be a testament to like what it can do.
Yeah, definitely.
Yeah.
So talk about your this is on your website, your screening process for patients, and then also what are the most common conditions that you see?
Great question. So so when I meet a new patient, I usually run them through an exam, like a super rigorous kind of thorough exam. I often would like to do a full body exam, obviously kind of hit all the, pain areas, but because of time constraints and things like that, I usually just focus on what the most problematic area is, and then we'll do kind of intermittent like testing moving forward to kind of tackle that. But the idea is you're not just looking at the one area that's hurting, you're looking at the whole body and the way it's moving together, because a lot of times people aren't in pain when they're just sitting there. They can be. But the pain happens with moving, and sometimes it's not just moving, but maybe it's moving under load. And so being able to observe that and then being able to treat that is, I guess, what I'd be looking for.
And what's the most common injuries that you see?
Oh, yeah. Okay, so probably knee injuries.
Oh, yeah, I know about those.
And I love treating knees, so this is very exciting for me. But I also...
Cool. I got kind of bad knees, so let's go.
Yeah, but I also kind of more than specific injuries, I see a lot of anterior chain over dominance. So like,
explain what that is. I'm not sure.
Yeah, so sometimes you can discuss the body as like anterior chain and posterior chain. Posterior chain being everything on the posterior side, like glutes, hamstrings.
Your ass.
Yes, your ass.
Okay.
The back, the mid back, all that's posterior chain. Even like external rotators for your shoulder. And then anterior chain is like pecs, quads, things like that. But fighting is very anterior chain heavy. Doesn't matter if you're a grappler or a striker, you're going to be using primarily anterior chain muscle groups. So it's important that your strength and conditioning and or physical therapy is still looking at posterior chain muscles so that you're staying balanced all around and not getting like tendinitis in the pecs or tendinitis in your bicep, because it's overworking, whereas you need a little bit more like external rotators and posterior deltoid to help kind of balance out the shoulder joint.
So would you say those are the most common injuries that you see?
Yeah, I guess shoulder and knee.
Seems like people have I know people that have had like 6 shoulder surgeries and definitely knee replacements. I mean, hips too. I always hear about hips. People have bad hips.
And low back and neck too.
Rotator cuff.
Pretty much everywhere.
Yeah, everywhere.
Pretty much we're all fucked. We're all gonna have fucking problems, and it's gonna be one of those, or maybe multiple.
Yeah.
Oh man.
So you want to talk a little bit about how COVID affected business and your training schedules, traveling to your patients and stuff like that?
So that's a great question. So back in March, I guess I went from going to I was at 1,000%. I was like working every fucking day.
I hate March.
Dude, March will never March marked the fucking end of the beginning of this full fucking whatever you want to call it.
I was literally halfway through the fight camp. I was supposed to fight in April. I
remember that. Yeah.
I was working every day nonstop, and then suddenly it went from that to nothing. I literally training stopped, work stopped. I literally only had one client, and he was still training for a UFC fight, and that's the only reason why we kind of kept to it. And I told him I was I don't even know what's going on in the world right now, but I'm gonna be super super fucking safe if you want to still work with me. So I was super safe, while I was working with him, and it was kind of lonely. I couldn't hang out with anyone.
Yeah,
so
it sucked.
It was a lonely ass time, and it was really hard.
So you basically lost your business for that time.
Yeah, I had 2.5 months of basically no business, minus this one guy. And so I was at a loss of what to do. I wasn't training. I was like, I love food. So I was like,
Started eating.
I was like, Insomnia Cookies better fucking sponsor me. I was like, literally eating Insomnia Cookies every fucking day. I like gained so much weight. I like couldn't motivate myself, you know? And then things started to open back up. And so business started to pick back up. And then outdoor workouts started to happen. And like, I was still trying to be super careful because like, I work with high level people. If I make them sick and cost them a fight, that's their salary, and then that's my business.
No business, yeah.
So trying to be like safe through it all and like not offend people and like still get the training in and still getting work in was like a huge challenge, but it picked right back up when things opened up, and I've been really fucking busy ever since. But that being said, things are getting pretty bad again, so I'm looking to probably close down for a couple weeks while I just work with the competitors. Because, you know, people are still cross-training at different gyms and stuff, and like it's one thing to be exposed to the people who are, you know, we're all just seeing the same people, but then if I keep exposing myself and then bringing it back or vice versa, then like, you know.
That's tough.
Let me ask you this as a medical professional, what is your thoughts on COVID?
I mean, it's probably unpopular, but
Well, no, but hey.
Honestly, you know, my belief is if we had a real ass lockdown right away, we wouldn't even be in this fucking position. But we didn't have a lot
of people have said that.
Yeah, and we didn't have a real lockdown. No matter how you put it, America did not have a real lockdown.
Compared to other countries.
Yeah, compared to other countries.
We interviewed our friend Mick out in Australia, the artist, and
I listened to that.
They were on lockdown up until like a couple weeks ago.
Okay, now it would be probably like 2 months ago, but
that wasn't even 2 months ago.
When we recorded him,
I don't know, maybe a month and a half, whatever. But either way,
yeah. But they were, and that was like he said that they were on full lockdown since March, and they just I think when we did the show, it was like 3 weeks past, so it's probably 2 months. Yeah. That's crazy. That is. But he also hasn't had 14. They haven't had a case at all.
Well, that was then. I don't know about now.
Death. Well, I don't know now, but I mean, at that point, after the lockdown for that long, they didn't have any cases.
Yeah.
No,
which is crazy.
Well, it's been overall frustrating because I mean, yes, the masks aren't super effective, but there's studies that show that a face covering is more effective than nothing. But that being said, the air ventilation is like the most important thing. But then things like bars and stuff that don't have good ventilation are staying open, which is like, okay, they have outdoor seating, but then there's like so many people, and then I see things on fucking IG where people are going to like clubs and stuff, and it's like, well, I can't see you now because you're potentially putting me in danger, and then I'm gonna put fucking all my clients in danger. So like I've been trying to be as safe as they can.
Well, that makes sense.
You're 6 feet away, so
So are you a fan of the masks or no?
I mean, I wear it. I wear them. I think you should wear them. It's not gonna suffocate you. I hate wearing it working out.
No, it's definitely not gonna suffocate you.
Don't get me wrong. They are fucking a pain in the ass to wear when you work out, but I do it. It gives me face acne. I just wash my face more.
Fair enough.
I'm just trying to protect other people.
Yeah, they were saying that it's only like the virus is only bad if you're like for example what we're doing right now, a podcast where we're sitting here for a substantial amount of time talking. That's when it's bad. If it's just like a quick if I just see you on the street and we didn't have a mask on, there wouldn't have been any really exchange of anything.
Yeah,
it's more of a prolonged session.
Yeah, and like one thing too is because my immune system is pretty strong. I feel like pretty confident I would probably be okay, but I have I have insomnia sometimes, so like there's been days where like I don't go train and I'll just sleep, because even though I don't have as much training time right now because I'm like running around all over the place, I don't want to like risk decreasing my immune system and then exposing myself and then bringing it back, it's just like I'm just trying to be super careful. Cycle. Taking care of myself, and then hopefully that helps take care of everyone. Speaking
of insomnia, you brought up insomnia cookies. Now we have one. We have one in Providence. No, we are, because I'm curious, because I've never been. Okay. I've never been to one.
I haven't either. But I see college kids there all the time.
Is it just like a late night spot, or is there some gimmick to it, or
what is the deal with it?
Because I love cookies.
Now she's promoting. But here's the thing: she's gonna talk about insomnia cookies. So if anyone from Insomnia Cookies hears this, you should sponsor her.
Because I love cookies. But I love they have their cookies are really good, and they're like soft, but they're like crunchy, but they're not stale, and it doesn't matter. They're never stale. They're great, and I sometimes they're on a little bit on the sweet side, but I mean, you're fucking eating a cookie.
Yeah, but what is it? So it's just like a. It's like
It's
like a cookie
what
shop.
is it comparable to?
It's just a cookie shop.
It's a cookie shop.
What are they
Cookie shop.
comparable to as far as cookies go?
As far as cookies go, I mean, they're
Chips Ahoy, Oreo, what
Otis Spunkmeyer.
No.
Was that what?
because they're like fresh baked, so like you
Bakery.
get that fresh baked cookie.
Remember when
feel. I don't
Krispy
know.
Kreme used to do their donuts and fucking you get them hot off the press?
Yeah, I do actually. Do they still do that?
There's no Krispy Kremes anymore.
Oh, they closed?
Dude, they closed Krispy Kreme in Cranston like fucking 10
Really?
years ago.
Oh, I didn't know that.
Yeah.
But I see them in the
No, they
stores.
still have them open somewhere. I don't know.
Yeah.
Not here.
Yeah.
Going back to the COVID real quick. How do you feel about the numbers? And do you know? I mean, you're in the medical field. Do you know anybody that works in that part of the medical field? Hospitals or?
Yeah. I mean, one of my best friends who lives in New York, she works at a hospital. She's a physical therapist.
Okay.
Her fiance is a sports medicine doctor. They work in the same hospital, NYU.
And what does she have to say about things?
I mean, I'm sure she disapproves out of everything that I do, because like sometimes I'm like, I'll like take a picture with my sparring partners with no fucking mask on, and I'm sure she's, I haven't really talked to her that much, but I don't want to stress her out. But I know I'm getting I'm low key like getting a lot of kickback from my peers because I'm working with
in the medical field.
In the medical field, but at the same time, it's like, I mean, I don't know.
Now, do you think? Now, this is a lot of people have this theory, and I'm kind of leaning towards this way myself, that the numbers are inflated. They're manipulated. I've heard things such as people that work in hospitals, unnamed people, but people have said like, "Yo, they basically tell us that if someone comes in with any ailment, mark it down as COVID. If someone dies, mark it down as COVID."
Some people,
and because the hospitals get paid for that.
The nurses sent. We talked about this before. The nurses sent. They sent same girl sent 4 strips that were blank. Like she didn't even do anything. Didn't breathe on them. Nothing. She just sent them, and they came back. 2 came back positive for COVID.
Yeah.
And they just sent them back.
Yeah. I can't really comment on that because it's such. I mean, it's so beyond me.
Yeah, it's not what we deal with.
But yeah.
Yeah, I just figured I'd ask, since you are a medical professional.
Stressful and frustrating, but it's like, all I know is people are getting sick, people have died, and I'm trying to like not.
I think it's definitely real. I mean, we've talked about it a lot. I think it's real. The virus is real. I know someone that died from it in New York City, actually.
Yeah.
But do I think there's some shady stuff going on behind the scenes? I think
We've made it so
so.
political. There's
It's fucking insane.
Yeah, it's ridiculous.
Now, you don't have a base of operations right now, right? You don't have an office or anything. You travel to your clients.
Yeah, I've like low-key called myself like a Ronin concierge.
Hell yeah,
PT.
that's hard. That's dope, man. Fucking samurai shit.
Yeah. I'm like, my goal is like, I want to be part of like an interdisciplinary team. Like you see physical therapists working like NFL, NBA, whatever, but like, and the UFC just built the UFC PI. So like physical therapy is now a thing that the fighters in the UFC have access to, but like on a local level, it's just like their insurance, or if they don't have insurance, whatever they can manage. But it would be cool, MMA is like one of the fastest growing sports right now because it's fucking brand new.
Yeah.
To really kind of like show that there's a place in this sport for physical therapy.
Of course.
And, our goal is to prolong your career.
Right.
I just want to make you, be able to get to that next fight in the best shape possible for like 10 years or 20 years. I don't give a shit. Like, let's keep doing it. Let's keep fighting.
Yeah,
but like, that's my goal. And I think one of the biggest things that is hard sometimes, not having a base of operations, is that, I treat people across all gyms and camps. So sometimes there's a little bit of like, I don't want to work with TK because she works with somebody from this gym.
Oh, really?
So like
a little bit of politics.
Yeah, so I've gotten a little bit of that.
Really?
And,
rivalries between gyms.
But also just like worried that I might like share a secret or someone might find out this and that. So I'm like, HIPAA is like the law.
Yeah,
so
right.
But I try to be super like.
I mean, in the MMA world, it's not like we're talking about kung fu and 500 years ago in China. Like, what? I don't know. I mean, I still understand, I guess, to a degree, but.
Yeah, well, I guess more in terms of like if there's an advantage if someone's knee is injured or something.
Yeah,
I'm gonna attack your knee or something. You know, so like I try to keep things super quiet. Like if they don't post about it, I don't talk about it.
Yeah.
Yeah, that's smart. That's professional. Maybe they should have some kind of confidentiality like clause or something that you gotta sign.
Oh yeah, I do.
Oh, you do?
Yeah.
Okay. So yeah, I mean you're straight then. So what do people care? Like what the fuck, dude? Like you're traveling. If anything, you're making it more convenient for them.
I try.
Yeah. Now you travel primarily in the Boston area, Massachusetts.
Mm-hmm. So we're licensed by the state. So if I wanted to come, to Rhode Island to treat, I'd have to have a Rhode Island license.
Okay, because I have like friends in martial arts community here too. So if they wanted, say, they needed physical therapy, they'd have to come. How would that work?
They could come see me, I guess, but because I don't take insurance, so it doesn't matter.
Oh really? No insurance?
on that, yeah. And people have like asked me about that. They're like, you don't take insurance. Like, when are you gonna start taking insurance and make that money? And I'm like, no, not insurance doesn't reimburse that well. Like,
really?
Yeah. Like, so one thing that's like really annoying about physical therapy being a doctor right now is we're a doctorate level degree, which means we pay that fucking money, and we don't get our salary is not doctorate level salary.
Really?
So like the student loan debt is like real.
Wow. Is that just with physical therapy? Because I was under the impression, like, that's the reason why, like, regular, like, I don't want to say regular, but primary care physicians, for example, see so many patients. They can only see you for 15 minutes because they have to. So
that's like a reimbursement thing in general. Like, doctors aren't getting paid what they used to. But physical therapists aren't getting paid like we're doctors. We're just getting paid like we're fucking not a doctor.
Even if you have the education.
Oh, yeah. It doesn't matter. So, I mean, they really say to us in PT school, you're not going into PT for the money, you're going into it because you like what you do. And it's like, it's true.
No, I mean, that's why, we do a lot of things that we do,
Yeah.
For sure.
Oh, yeah. So, you want to talk about a little bit, I know you mentioned Tiger Balm. I don't know how natural Tiger Balm is, but you want to talk a little bit about the use of holistic natural traditional Chinese medicine for injuries? I
don't usually recommend too much outside of PT just because it's just beyond what I can say. And honestly, like, for the most part, they're fairly harmless in the sense that if it works, great, because it does sometimes, but if it doesn't, probably nothing happened. Like, like, so there's no harm in trying it.
Yeah.
And if it, anything that can decrease pain, I'm a fan of.
Now, what about personally? Have you tried any traditional Chinese medicine or remedies or anything holistic?
I've done acupuncture a few times, but I'm really just bad at taking care of myself. So I never go to get massages for myself. I do my physical therapy exercises in a corner.
Well, can you massage yourself?
I mean, it's super hard, but sometimes I do try to rub my neck. But I've dry needled. Yeah. There's like 2 times I've dry needled myself because it's been so bad. But the real answer is I'm so bad at taking care of myself that I have not tried other things.
All right, cool. I mean, I just figured we'd ask that.
I know mechanics that the cars are shit.
Right? I know, it's crazy.
My stepdad's a contractor. The house, they're selling it. Even in 20 years, the house ain't done yet.
Yeah. Exactly.
I work all day at doing this. I'm going to come home and do it.
Like, I take my own advice when I'm, like, dying, but otherwise I'm just like, I'll get by. So do as I say, not as I do.
Yeah, exactly. Right?
The $1 million question, physical therapy or surgery?
I'm always fucking gonna push physical therapy. I don't give a shit if you are scheduled for surgery.
I hope so. If you're cut your throat.
No, don't come see me. Go get surgery instead.
I have one example where I was so frustrated because somebody came after shoulder dislocation and the doctor said, do prehab. And I was like, thank God that you came here because, after we worked together hardcore for like 2 months and by the end he didn't need the surgery. And I told him, I was like, look, you can do everything that you need to do and more, and you don't need to go do the surgery because he had it in his head that surgery is like the thing that fixes everything. He went and got it anyway, and then we fucking have to start from square one. Shoulder surgery is such a long rehab that I was just so frustrated. But if you can avoid surgery,
Yeah, I mean, that's what I've always been told.
Like, you're never going to quite be the same after you go under the knife.
Yeah.
And,
the rotator cuff. My father had his rotator cuff done, and 3 times, and that's like a fucking crazy.
Yeah, I mean, shoulders. People always have multiple shoulder surgeries.
Yeah.
Yeah, it's crazy. Yeah, he has.
Yeah.
Yeah.
I know someone that's had like 6 or 7 shoulder surgeries.
Yeah, I mean, don't get me wrong. There are times when you need the surgery.
Yeah.
And for athletes, for example, if you have an ACL tear, I almost always recommend getting the surgery because you can live without an ACL if you're not an athlete. But if you're doing a lot of dynamic motions, you need that stabilizer.
What else is there? Meniscus, right?
Meniscus, PCL.
ACL.
Those are long healing processes too, right?
Well, ligaments have very poor blood supply, so anything with ligaments is going to be very, very slow. Like, you can tear a ligament and not get surgery, and for the most part, you can, get back to life sooner than a year. But like the cell turnover rate for ligaments is like a year.
Is that why they have a problem with the Achilles tendon?
Well, the Achilles you can't. I know people who have partially torn it and have, we've gone through the rehab and it's been fine, but there's one guy I had who partially tore it and we tried to rehab, wasn't quite getting better, and then he just lost his balance for a second and just ruptured.
Oh,
but the problem with the Achilles is just it's one of the most. So the Achilles is attached to the soleus and the gastrocnemius, and those are the drivers of gait. So it's like a very high-functioning tendon. So usually when people rupture that, they say that it feels like they were shot in the leg or they were kicked in the leg because it just snaps.
Yeah, my uncle Billy had his is all fucked up. He has to wear like certain type of socks and shit.
Yeah,
really?
Sometimes after the recovery,
yeah.
Like the compression socks, like
why wear those anyway?
It's different than what you're talking about. No, they're like specialty.
They're like
ones.
super tight.
They're
like stockings and yeah.
Well, so definitely, if you can, get the physical therapy and hit up TKO. Let's go back to the martial arts for a little bit here.
Yeah.
Now, you've had some fights, Taekwondo, right? You did compete in Taekwondo and obviously Muay Thai. Just run us through quick a little bit of your training process before a fight, maybe your diet and getting ready and preparing.
Yeah, so, one thing that's nice about what I do is that I've gotten to see a bunch of fighters go through their own fight camps before I had to go through my own. And because I had done a ton of continuing education actually in the strength and conditioning realm, because there was a lot of combat athlete specific seminars and stuff, I feel like I kind of run my own training life like a pro athlete almost. But anyway, to go into that a little bit more, I do like rigorous strength and conditioning twice a week at SOS in Chelmsford, Mass. I love it there because the guy is super duper fucking smart, and so I don't feel like I have to worry is my program correct? Does he know what he's talking about? I know I don't have to fucking think about that. I usually train ideally I train Muay Thai 6 days a week, but right now I'm only doing 4 maybe. Mm-hmm. So my training hours compared to pre-COVID are probably cut in half, but because I've been doing a lot more privates. I see Chip 1 or 2 times a week.
Yep.
There's a lot of female fighters at the gym Hard Knocks, so I've been actually training a lot with Hard Knocks a couple times a week if I can. Sometimes I'll go see Kyle Bochniak is starting a coaching business, so he's been helping me with my boxing sometimes. Actually been working with Peter Barrett also for boxing.
Slippery Pete. What's up,
Pete?
So I've been just trying to get a bunch of privates, which honestly has really helped the fact that I'm not getting enough hours.
So you're trying to make up for it that way.
Yeah, it's expensive. All of my free money goes there, but it's worth it to me. So.
What would your diet be before a fight? Because you obviously got to cut weight and everything.
Yeah, so no cookies.
Damn it. No wasabi or cookies, dude?
No fucking cookies. It's the saddest. I'm ornery. Ask my fiance. I'm
what about oatmeal raisin cookies?
Well, oatmeal raisin cookie is not a real cookie. Fuck that cookie.
Technicality.
It's not. It's like a deceiver, but no. So I tend to go real clean. I eat a ton of vegetables. a ton of eggs. Like I try to get enough protein in, but I don't go keto. Like I keep carbs in.
Yeah, you have to when you're training.
Yeah, like I don't ever cut the carbs, and I just really like carbs too.
Yeah, me too. I love carbs.
He's not supposed to eat them. He fucking loves them.
I'll eat a whole loaf of bread. I can eat carbs.
Me too. I love bread, so like yikes. But yeah, I don't ever cut my carbs except for like the last week when I'm trying to really cut water. But I usually still eat breakfast because I'm so on the go that like my meal timing can be really terrible if I don't eat breakfast. So I'll eat breakfast. It's usually like eggs and then some sort of carb. And then my lunch is like super vegetable-y. And I usually have like an avocado toast with lunch because I love avocado toast.
I want to try. I haven't ever had avocado toast, but I would like to try it because people post it everywhere.
It's avocado, avocado on toast or...
Yeah, it's usually kind of
like... a toast made of avocado.
No, it's like avocado.
I don't know.
It's like a grain bread, and then it's avocado, like a guacamole spread on.
All right.
Because everyone is like, it's like fancy. You never had that? And avocado is very healthy. No, because avocado is like
fucking bacon and shit.
Yeah, it's just, dude. All you gotta do is get avocado and toast.
You love avocado.
I do like avocado.
It's a healthy fat. It's a healthy fat. So, but it's just bread, avocado.
Yeah, so it's not toast made of avocado.
No, I know that.
Okay.
It was just a.
I thought that you might have thought that.
No, never. No,
well, maybe I thought that's the thing. I don't know.
It could be.
It's getting more popular. Oh, they couldn't make an avocado loaf.
Yeah, that's what I'm saying. That actually sounds good.
Yeah,
see,
if anybody knows of any avocado loaves out there, please let us know.
Yeah.
I'm not a baker though, so I don't know who's gonna bake.
I don't know. We'll find somebody.
My mom's a neighbor. Fuck yeah, what's her call? She does it. Erin, she bakes.
Oh my god.
So, you want to compare a little bit traditional martial arts to MMA?
Yeah. Because you would consider Taekwondo traditional, right?
Yeah. So, I can't speak for a lot of other gyms, but I do want to say one thing that was really interesting was I resisted MMA for a while.
Really?
Because I mostly stayed in the Taekwondo world, and there was a weird thing going. I mean, it was like specific to our gym for whatever reason, but everyone was under the assumption that if you are an MMA fighter, you have to be inherently an aggressive, evil person to be able to fight, spill blood, and make money. And like I was just like, really though? I was like, what about football?
True. Yeah, that's a great point.
So, I mean, for a while, I just didn't think about it too much, to be honest. And then what happened was one of my friends from PT school, she was like, hey, I have an extra ticket to the McGregor-Cyber fight. You want to, like, come with me? And I was like, I guess, sure. I don't know what you're talking about. But so I went to that fight, and it was my first UFC fight and first MMA fight. And I was just like, wow, this is super fucking cool. What I really liked about it was that it, as a martial artist, you always want to be like, I want to be well-rounded. I want to be able to like defend myself and shit. And one thing that was like frustrating actually about the first martial art that I did and Taekwondo is like, they market it as self-defense, but I never felt like I could defend myself.
Oh yeah, I've been through that.
Like
I know exactly how that is.
A lot of the first stuff had the Hapkido stuff where you're like breaking grips and stuff. It's like, if you can see my wrist, if anyone knows my wrist is tiny.
Yeah.
Any dude, even my own hand can close around my wrist.
Yeah.
It's gonna be, none of that shit's gonna work when the time comes.
It's not realistic.
And so MMA, I was like, oh, you can do like one sport where it's like all well-rounded, you can grapple, you can do this and that. I was like, that's what I want to do. I was like, I thought in my head, MMA is like, like the epitome of a well-rounded fighter.
Yeah.
So, I mean, in reality, because it's still a young sport, there's a lot of people nowadays are still like specialists in striking or whatever. And I guess like just as people are, you're always going to have like a preference or whatever. But that being said, like between traditional martial arts, I feel like it's just a little bit more well-rounded actually.
Yeah.
But it's still a sport, and it's honestly, I don't get the sense that it's ever marketed as self-defense, even though sometimes people want to say that.
Yeah.
And I like that about it, but at the same time, like if you're really training MMA or even Muay Thai and sparring, then maybe you can call it like, you
that's
self-defense.
Yeah.
But
I think
Otherwise,
if you learn
it's
how to
so
fight,
different.
if you learn how to fight, it's self-defense.
Yeah.
Now, some people have said, well, MMA lacks certain traditions that you see in traditional martial arts, but traditional martial arts aren't realistic. They, there's a lot of bullshito, as they like to call it. So I don't know. I like to look at all sides of the coin, the fence. And
one thing that I guess is lacking in MMA is like the psychology, or like not the psychology, the philosophy or whatever. Like, I feel like they don't, like, in traditional martial arts, it's like, it's very drilled in, like, oh, like you can create danger, but now you must, like, be peaceful.
The spiritual side, the balance.
The spiritual side. And like, you kind of get that sense in MMA, like, you're like, oh, like what is it? There's like a meme that was like something about creating great violence. You're not a peaceful man unless you create
capable of great violence.
And I think once you get to a certain skill level, you kind of get that sense, like, oh yeah, I could really fuck someone up, but I'm not gonna. But at the same time,
you just know.
But you just know, like,
you know what you can do.
No one is.
It's humbling.
Yeah, no one is kind of telling you to, like, chill the fuck out, unless, like, you start causing trouble, and then it's like a forceful chill the fuck out.
Yeah.
But yeah.
Did you do a lot of conditioning in Taekwondo, like body conditioning?
I mean,
like traditional conditioning, like
where they like punch
like
you in the stomach and like
like they do in Okinawan styles of karate or kung fu, a lot of styles of kung fu.
I want to say not as much. I mean, by the time I got back into martial arts, it's kind of like to the point where it's more exercise than martial arts, if you know what I'm trying to say. I feel like nowadays martial arts has become such a fitness industry as opposed to like a martial art.
Well, that's a good point. How do you feel about how Taekwondo has been marketed?
Yeah.
In this country, especially over the years, when it exploded, I guess, in the late 80s and early 90s, and everyone had opened up a fucking karate school, Taekwondo school, and it was like every little kid, all right, I'm doing karate, and
so
a lot of it was bullshito.
Like literally though. And I mean, because I tend to take my training kind of seriously, I'm always trying to look for the school that's the best.
Yeah.
And it's really hard to find. And I started looking when I was in Colorado, but like there are so many bullshit gyms, and part of it is because when they brought it over from Korea.
The CIA is here.
Oh God.
Yeah, we didn't tell you.
I thought Vagabond Rob was pulling up in the bike.
If you don't hear from us after this, then now you know why.
So I don't hear from anyone. Put money on my books.
All right. So as we were saying.
So when they first, opened a few gyms
before DEFCON 4 showed up.
What are they parachuting down right now?
What the fuck you been doing, dude?
Nothing. Just sitting here all day. They're like fucking creeped out.
No, but I feel like back in the day, Korean black belts would come over, open a gym, and then the first wave of black belts that popped out of those gyms, they all just went out and opened their own gym. First degree black belts. And if you know anything about traditional martial arts, think about like a Taekwondo first degree black belt versus a Jiu-Jitsu first degree black belt. A Taekwondo first degree black belt doesn't have nearly as many years.
No.
Like there's no way they're experienced.
Yeah. It's almost like they were just selling belts. Like that's what it became. It's just marketing, and here we go with marketing again. But it became almost like, it was just a business plan. You know what I'm saying? Not really about the martial art. And I think that affected a lot of quote unquote traditional martial arts. Yeah,
and I totally get it. Like to survive in like the current world, you have to like scoop in those like recreational practitioners. But it was to the point that even, like the gym that I trained Taekwondo at here was marketed as like the best Taekwondo gym around, and it is, but at the same time, like it's still such a fitness place that the competition team was hurting. And so like I tried to go back to the competition team after like 2 years out of my injury, and it just like before you had to be invited to the fight team, and then suddenly they were just like, people who weren't ready to like being there, and it was just like I was just like I need to compete, and honestly that was the push that pushed me to
But I think that might even be happening with MMA too, because there's been gyms that they people fight after training there for 3 months. They throw them in the ring, the cage. And MMA is marketed too, like, and then you've seen a lot of traditional schools started putting MMA on their signs. Like, yeah, we offer MMA because it would draw people in.
Yeah.
But is it really MMA training, like, if you were preparing for a fight?
Yeah, exactly. Which I think makes it training for MMA very hard, at least, like, I mean, I can't speak for anywhere else in the country, obviously, but, like, here, you have to go to, like, the best Muay Thai gym and the best boxing gym and the best grappling gym to get your training in. There's no, like, one location. And same thing with, like, strength and conditioning, which is why I try to, like, be a concierge, like, travel to UPTs, because they're already traveling around to all these fucking places.
True, that's, yeah. And the other thing, too, is some people would say, well, MMA fighters are pretty good at a couple of different things, not masters of any one particular thing. But I don't know. With jiu-jitsu, I don't think that's really the case most of the time.
Honestly, so I thought about this kind of thought as well.
But MMA striking, some would say, well, if you look at a Muay Thai fighter and an MMA fighter, the striking, the Muay Thai fighter is just on a different level.
It is, but you're also just not worried about as many things. Like,
right.
You know, I'm a Muay Thai fighter, and, like, you know, good luck to me if I'm fighting someone who knows jiu-jitsu, because if I'm not even gonna know what the preparatory motion for a double leg takedown or whatever it looks like.
Jiu-jitsu or grappling.
So, like, they'll just come right in. I'll think they're coming in for the clinch. They'll just take me right the fuck down, and then I'll be like, well, you know, I have one stripe, white belt in jiu-jitsu, but that might not save me.
Do you have any plans to venture into MMA and the grappling world?
You know, so I did do jiu-jitsu for like a year in 2017, and I stopped right when I started my camp for my first Muay Thai fight, because they don't complement each other at all. No. But so it's been a while, but I did really, really enjoy it. And the problem is I'm more proficient in striking because of my Taekwondo background, and it's easier for me to enter the competition world with a competitive, like, edge in the striking world than in MMA. I'd have to do, like, I've literally thought about this because so many people this year have been like, just do MMA, TK. And I'm like, this is the time, I guess.
MMA's the moneymaker, I guess.
Yeah, there's more money in it, but, like, for me, I'm like, physical therapy is my job. Like, the fighting wouldn't be for the money. It's literally just because I'm a weirdo who wants to be beat up. Yeah.
No, of course. Yeah, no, I hear you. I've trained, like, jiu-jitsu on and off, you know, grappling. Right now I'm training some, like, wrestling stuff. Shuai Jiao. Shout out to Standout Fighting Arts, my brother Ty. But I hear you, though. It's tough, man. Unless you know, like, yo, I'm going to go fight MMA, you might be like, I'd rather just train, you know, one or the other.
Honestly, so my personal goal would be to be good enough in Muay Thai to be a low-level pro.
Okay.
And
well, you're almost there.
I want to be almost there, but I feel like there's so much work to do, and you know,
it never stops.
It never stops.
No, it doesn't.
And I'm kind of focused. I want to focus on that before I decide that I'm gonna pause for a second, put a shit ton of work into wrestling and grappling.
Yeah. You want to, like, get to a place where you feel like, okay, this is where I want it to be with my striking. Yeah. And then maybe I'll venture into, you know, the grappling stuff more.
Although at the same time, I guess, like, from what I understand, if you fought pro, then if I fought pro in Muay Thai, then I have to fight pro if I switch to MMA. I don't know. That's what I've heard.
I don't know.
You know, because it's weird to be pro and then go amateur.
Yeah, that's
I don't
a good
know.
question.
But it's two different.
Two different art forms.
Yeah. But I've heard that as well from, like, MMA trying to do, like, a Muay Thai fight and shit like that. So I'm not sure what.
The thing too is Muay Thai is a traditional art at its core. I mean, the history of it is from the battlefield and, you know, Thailand, Kingdom of Siam, and it started, you know, there's other arts that intertwine with it, that they use weaponry. And Muay Baran was very fucking brutal. Like, it was a killing art. It wasn't sport. But then it became that later on because they weren't, you know, trying to kill each other all the time.
Yeah.
So it is traditional. Muay Thai is definitely, and Crew Mark, obviously, he's an expert on this. And he has a good video on YouTube where he gives the history and stuff. And I've heard him talk about it. It's very interesting. But people might not realize that.
Yeah, I love Muay Thai.
Yeah. No, it's a great, I mean, arguably the best striking art.
Yeah.
You know, I think it might be. You know, I mean, boxing's great too, but boxing you're only using your hands.
Yeah.
You know.
Totally.
Yeah. But shout out to all the Muay Thai fighters out there, Knock Muay as they call them.
Actually, getting away from martial arts, you want to talk a little about your artwork?
Yeah. I stumbled upon her artwork. I'm like, yo, you're fucking good. Like,
thank you. So I was saying kind of earlier, like, I always wanted to be a bunch of other things than a doctor. And like my first
astronaut.
Yeah.
Astronaut. You can still be an astronaut.
I could still be an astronaut.
Man, fucking. every kid.
Literally.
Jack of all trades.
I remember I always wanted to be an artist. Like literally, I'd be like, I want to be an artist. I want to be an artist. My mom would be like, hell no, there's no money in art. I remember that from like
That's what they always tell us.
watching Bob Ross.
Your mom was stern, huh?
She was stern. She was a tiger mom. Yeah, that tiger mom. But no, I wanted to be an artist. But so I was always drawing. But she didn't really let me take art class because she wanted to like make sure that didn't happen, you know. And so I literally always drawing like nonstop throughout grade school. Even I took small commissions because I'm a nerd, and I loved writing, and I would write and role play online, and I would draw people's characters for them, and I would like make small money doing that.
That's cool.
In high school, yeah, and so. But after
that's how you get your commissary in prison. Yeah, it's like you can't lose that talent. Yeah. Draw some envelopes.
Yeah, so I always thought I'd keep up art way more than I do now. Like I only started drawing again. I stopped drawing it when I started college. I didn't draw again until the quarantine.
Oh really? Oh wow.
So I did a few pieces, including I drew my dog and stuff. But
what kind of art? Like, what kind of art do you focus on?
Yeah, that's a great question. I don't even know how to answer that because before in grade school, my art was very like illustrative. Like I'm drawing like a scene, or I'm drawing I draw a lot of wolves. I'm like obsessed. Sorry.
With wolves?
With wolves.
Nothing wrong with wolves.
Yeah, I like have a bunch of I have a few tattoos that are all wolves. But
where does your wolf inspiration come from?
I'd always loved animals. I thought. Another thing, I almost became a zoologist.
Another one.
There's a fucking nerd in you.
Well, if you come back in another life, you already have an idea of what you want to do.
I did go to zoo camp once.
Nice. Yeah.
for one.
No, I have
one
like
summer.
I have a lot of random animal knowledge because of that, but
that's another podcast.
Yeah. I would read a bunch of books about animals, and I remember I picked up in the 4th grade. I picked up Julie of the Wolves. And it literally changed my life. Like, I don't know why, but I was just like, this one, I didn't read a lot of books about Asian. She's not Asian, but like on the cover, she kind of looked Asian to me. So I was like, oh, I can identify with her. Like, she's someone that kind of looks like me. And then like, she's like stranded alone. I would like, I just felt like always like a solitary introverted person. So like metaphorically, I was like, I identify with this character, and the wolves were just super cool. And I loved that interaction that they showed with the girl. And like literally like ever since then it's been wolves. Ask my sister, she'll like be like,
wolves
TK
are great.
Will not shut
Wolves
up
are cool
about
as fuck. There's like a wolf.
You might find one. You look at the backyard, they come out sometimes.
Well, they're probably coyotes. But then we got these other things too. They're like a hybrid of a wolf and like a coyote.
Yeah.
I've seen one in the city actually. One night I was driving home.
What's it called? In the city?
Yeah, dude. I was driving improv, and I was driving home, and like this thing fucking ran across the road. It wasn't a dog. It was bigger than a dog. And it stopped and looked at me, dude.
Bigger than like a German Shepherd?
I tried to like follow it and shit. Yeah,
really?
Nice.
I don't know, dude. It wasn't. And then someone told me last year. Someone told me that they're spotted in Boston all the time.
Yeah, I think like I remember my aunt who was in Vermont at the time. She was telling me that they would start. The coyotes would start breeding with the wolves and they'd be so fucking huge.
That's what happened. Yeah. So back to your art style.
Yeah. So my bad.
No. We went down a rabbit hole of a wolf hole.
A wolf hole. Yeah. Yeah. So I would draw more like illustration type things, like scenes or just a character with like a minimal background. But now I'm like, my art has evolved into something a little bit more abstract. I draw a lot of like crazy like sketches that like don't make any sense and like so every time I sit
Picasso?
down kind of more Picasso-y and
cool.
I'm like, well, that's cool, my brain is changing, but then I go to sit down to like draw something or paint something, and then I have a brain fart or like a mental block and like then I just end up not drawing at all. So I think like I said
when the inspiration strikes
I just have to do it. So
it's like we're writing music or anything like that. Exactly. Usually happens. And you say like to write. You still do that?
It's something I also have not done since I started college.
College ruins everything.
College does.
Yeah, it makes you focus on quote unquote getting a real job and becoming a fucking whack ass adult, right?
Yeah, for real. But
your mom's happy.
Honestly, though, she's not because
Oh, Jesus Christ, what the
she's never
fuck?
gonna be happy
You can't win.
I can't win because I'm a physical therapist. I'm not a real doctor.
Oh, no, you're getting that,
I'm
too?
getting that. No, you
Oh
can never
my
please your
God,
parents. So,
dude.
like,
Those snide remarks.
Oh
Yeah,
my
that's-
God. That's crazy.
Can't wait.
yeah.
Can't
So
write
you haven't written anything recently?
I haven't.
Well, COVID, you could have started back up, right?
I could have. I want to, and like
Should.
sometimes I get like perfection is the enemy of the good type of thing. Like
yeah.
I'm like I used to have such a good writing style. And, like my vocabulary was really good, and now it's like, what do I write? Like science things? Like, oh, this patient like presented today. Like what am I writing? Like boring shit. So like I gotta like rediscover that part of my brain, I guess.
Makes sense. Well, maybe you can start working on something. You can write a novel or something.
Yeah.
One thing too I wanted to ask you is you brought up the Celtic goddess. I don't want to mispronounce her name.
Oh, the Morrigan.
No, it was another one with a B. And actually, it's the name of Barbara's boat. Barbara Roberts.
The Boudica.
Yeah.
So she's actually a real life historical figure.
Oh, really?
Yeah, so super, super cool. So honestly, I don't know that much about her, but
Okay.
I read a historical fiction book also that also kind of like changed my life too, but that's like a whole separate story. But
Another podcast.
So
We do a
she's-
bonus episode on that.
yeah, but she's like super cool because she's known as the warrior queen, and it's back in the Iron Age, like right when Rome was coming to the British Isles to like conquer shit, and so like she led the first like resistance, I guess. But I thought it was super cool because growing up, everything is like everything was still kind of like men are the best and women.
Yeah,
whatever.
sure. Up until not that long ago.
Up until not that long ago, and
Yeah.
like even like when I was starting martial arts at like 15, my family was just like, but your face, what about your face,
yeah.
like what about your hands, like and like but
Is that why you chose Taekwondo?
no, it wasn't. It wasn't, but yes, I loved that character because it was my first exposure to like a strong real life female warrior.
That you can
I'm like,
relate to.
she can go out and like fight alongside men. That's fucking cool.
Hell
like
yeah.
a real person. Wait, I want to be like that. So yeah.
Well, you're on your way. You're kicking ass.
Thank you.
Yeah, definitely. That's cool. So what are your upcoming plans as of right now?
In the fighting world.
In general,
or-
everything.
Yeah. So I mean, a big thing that like for my business, I guess, is like has been whether to open up a physical location versus not. And I guess because I want to focus right now on my fighting career, if I opened up a clinic, I'd literally have to be there all the time.
Right.
Yeah. And
You have to do more marketing.
More marketing for sure. Damn it, the marketing again. But yeah. So right now I'm decided I want to focus on being able to fight.
Hell yeah.
So I'm not focusing on growing my career and my business. It's a perfect size for me right now, actually, between balancing training and seeing the people that I need to see. So I'm into honestly, I'm living my dream.
Hell yeah.
I'm like
Fucking
fighting.
right on.
Yeah, I'm like doing
Definitely.
the type of job I want to do.
Yeah.
It's like a fucking grind all the time, but
It'll
I'm
pay
like,
off in the end.
It will.
That's what I tell myself. At least that's what I tell myself all
Yeah.
the time. I fucking hope so.
Yeah. It better.
Yeah, right? Otherwise, you're getting fucked.
Yeah, so you're just gonna continue to see people and then train
Yeah.
and fight. Hopefully, we can get more fights going soon.
Yeah. I'm hoping there's
Fucking lockdown bullshit.
one thing that I'm looking
Fucked all
forward
that
to.
game up, dude, big time.
Oh yeah, totally.
Fucked everything up.
Yeah, well, definitely. Yeah.
I'm hoping there's a tournament that looks like it's gonna still happen in March in the South.
Oh, really?
So I almost tried to squeeze into the fall tournament, but the brackets were filled. So
Muay Thai.
yeah, Muay Thai.
Well, that's good to hear, though, that they're trying.
Doing something, yeah.
It
Hopefully,
makes it hard
you know.
because the brackets are really small because of COVID. So they
Right,
can't accept that many people.
Yeah, that's true. Yeah, that's crazy. Well,
Oh, you know what? I'm gonna feel like I'm asking everybody this, but do you think it makes a difference for having people in the stands fighting or not?
yeah, that's a good question.
Because I asked, people have different feelings.
Slippery
Like me,
Pete didn't care. He's like, I don't mind.
Me, I
Yeah.
feel like I would need it but people say like when you're in that moment, you're focused on that opponent.
Yeah.
That's it.
I'll say two. I guess I'll say two things on that. So one thing that I do in my business is every year I sponsor one big trip with an athlete, usually up and coming. So the first year And the second year, but not this year because of COVID, I went with a fighter to the Contender Series. Like, I didn't make them pay for my flight or anything. I did that. So, like, I sponsoring me being out there for them.
Yep.
So, I've already got to experience a situation where people are fighting without an audience. And it's eerily quiet. It's, like, so fucking awkward. But having had 2 fights now, when I'm in the ring, like, you hear the noise, but it's like kind of white noise. Like, you barely even notice it.
Yeah.
As long as
it's like when you're on stage.
I would love it. I need white noise.
I feel like
You'd be a good fighter then.
I feel like if you got knocked out of, like, the adrenaline rush or something, you know, you ate something really hard and then suddenly you're aware of the silence. I think that's where it would be, like, hella scary. But that's just what I imagine.
Yeah.
I think once you're, like, in the heat of it, you don't even notice.
Yeah, you're just so focused on the task at hand that you're not even fucking paying attention to the crowd. It's like getting on stage, man. Same shit.
Yeah.
You don't see fucking anything.
Yeah, like my fiance, he was like, "Did you hear us in the stands, like going TK, TK?" And I was like, "Honestly, no." And he was so sad, but I was just like, I cannot hear anything beyond.
Like now. I didn't even know where you were sitting. So TK, you want to give out some of your social media contacts, websites, anything?
Yeah, all where people can reach you and get a hold of you and check out your business.
Honestly, the best way right now is I'm working on a new website, but right now it's my Instagram.
Everybody loves Instagram.
Instagram is the shit.
Instagram's the king, bro.
It is. It's where
Besides these bullshit algorithms.
Yeah.
I know. Fucking algorithms do it.
Yeah.
Oh my god.
But my Instagram is at TKO_DPT, and you'll see my logo. It's a triangle with a wolf in it, of course.
Of course.
But hopefully there'll be real life marketing shit happening there soon.
Oh yeah.
We'll see.
Yeah.
But just hit me up with a DM and I usually respond pretty quickly.
And you have a website as well.
I do have a website, but under construction a little bit.
Okay, what's the website though? I know it's up and running because I was on it yesterday.
Yeah, so right now the website has a really lengthy name because I bought the domain before I started TKO. So it's tagyoungphysicaltherapy.com, but I'm working on building a TKOPT.com, so like it's less confusing.
TKO domain is going to be hard to get.
Oh, I already got it.
Oh, you got it.
Yeah. It's like TKO-DPT, I think. There's still a DPT in there, but the DPT is important.
So everyone stay tuned for the official website coming soon.
Follow on Instagram.
Follow her on Instagram. What's the Instagram one more time?
At TKO_DPT.
That's right. So make sure you give her a follow. And if you need physical therapy, she is the person to see.
Oh, yeah, man.
Especially if you're a fighter, pro athlete. And she will travel to your gym. All right, well, that was great.
Chrissy, anything else?
No, I think, that was really good.
Oh, yeah, man. Yeah. Great episode interview.
Yeah, thanks for having me.
Dr.Krystyna Mosher.
Hell yeah. Follow on Instagram, website coming soon. TK, thank you for coming on the show.
Thank you very much.
You.
And that's it, right, brother?
That's it.
Street Corner Soapbox. We're fucking out of here.
Peace.
The Street Corner Soapbox.
If you're a fan of the podcast, you can help support the show by donating to our PayPal at paypal.me/Street Corner Soapbox.
That's right, guys. Make sure to like and share all of our episodes. And for easier access to our show, check out our link tree at linktr.ee/Street Corner Soapbox.